Hello and welcome to Refuge in Conversation with, where we've been bringing you series of podcasts for Safer Internet Day. I am Djenne Kamara, project lead within the Tech Facilitated Abuse and Economic Empowerment team here at Refuge. With me is our special guest, Marie Vickers. Today, we'll be talking about intersectionality, online confidence, and digital inclusion in the domestic abuse sector. Let's get started. Over the past few weeks, the Tech Facilitated Abuse and Economic Empowerment team at Refuge has been bringing you a series of podcasts for Safer Internet Day. The theme this year is Inspiring Change, Making a Difference, Managing Influence, and Navigating Change Online. A reminder that this series, we will be discussing some really sensitive topics, including domestic abuse. If you are affected by any of our discussions, please know support is available. Contact the National Domestic Abuse Helpline on 0808 2000 247. And if you need BSL services, we have interpreters available Monday to Friday between 10 a.m. and 6 p.m. Deaf victim survivors can also contact Sign Health on 078 00 00 3421. But this service is text only. You can reach Sign Health for specialist support. As stated earlier, today we are excited to have Marie Vickers, Head of Domestic Abuse Services at Sign Health. Marie is a British Sign Language user, and we have Natasha Trantom, who will be our BSL interpreter. Hi, Marie.
Hello. I'm really excited to be here today.
Lovely to have you here, Marie. Hi, Natasha.
Hello, hi.
Thank you both. So Marie is going to share her expertise around the benefit and challenges of the internet for deaf victim survivors. Some advice about how deaf survivors can use the internet safely and how we can all put accessibility and inclusion at the center of our work. Marie's team and the Tech Abuse and Economic Empowerment team are currently working on the Tech Abuse Partnership Project. The project consists of teaming up with specialists led by and for agencies to upskill frontline practitioners around technology-facilitated abuse. The agenda includes consultation sessions, empowerment workshops, training sessions, and improving the tech abuse website. Now, I'm going to ask you, Marie, if you can tell us a bit about Sign Health and your role.
Okay, so Sign Health is a deaf-led charity. We're here to improve deaf people's health and well-being, and that's through providing various services. So, for example, domestic abuse support, psychology therapies, so that could be counselling, social care, and also supporting children and young people as well. Most of our services are for deaf people, which means it's about their lived experiences, and also the fact that we understand, their experience as deaf people because we're deaf ourselves, and we're here to support them. So my role is Head of Domestic Abuse at Sign Health. I oversee the domestic abuse services in England. We have deaf domestic abuse workers who support deaf survivors across England. Our team is based all over England. That's because we have local knowledge out there, and it's about how we can support those local agencies as well. So really, it's for deaf victims to become survivors. We work with BSL users as well. It can be British Sign Language or International Sign Language. We work with interpreters as well. It can be, challenging to try and match everybody's needs and communication methods. And that could be domestic abuse or sexual abuse.
Thanks for that, Marie. That's really, really good, that overview. You do so much at Sign Health. Thank you for that. Also, I wanted to know, what type of support services do you have at Sign Health? And I know you mentioned a couple of ones in the first question in your answers. What type of services do you have apart from what you mentioned earlier?
So within the domestic abuse team, within our services, we offer deaf victims and survivors from high level risk to low level risk. And that doesn't matter what the situation is. It's anybody who has experienced domestic abuse, and we're there to support them. So that could be meeting up with deaf victims, saying, look, these are the options that you have, making sure they understand their rights, how to protect themselves from perpetrators. It could be working with the police, it could be working with housing, various services, to almost signpost them to other services. And we work with those services as well to support them, so they know how to make their services accessible for deaf people. So we also signpost to local deaf organisations as well, and that's added support if needed. We also refer to the therapy teams, which means they can have therapy sessions to talk about, the emotions and the abuse that they've been through. We also work with different organisations, trying to work together to support deaf victims to then become survivors. So they feel that, yes, they have survived the domestic abuse and can move on with their lives.
Thanks, Marie. It's really good to know that not only that you're supporting victim survivors directly, but you also work with professionals to raise awareness and educate professionals. So that's really good to know.
Yeah. And, we do offer workshops to try and raise awareness, to explain, what domestic abuse within the deaf community, what does that look like specifically? Most professionals, do not know how to communicate with deaf BSL users. They don't understand the barriers that deaf people experience on a day-to-day basis. It could be they have relationships with hearing perpetrators or deaf perpetrators. How does that look? How does it feel for those children who perhaps are deaf or hearing? So it's just having that different perspective, but also we understand those dynamics. So it's really important for us to educate and give that information so services know that we're there, that there are deaf organisations, there's equipment that can, make sure that people are kept safe within their homes, to make sure they know about BSL 999s, because lots of people don't know about that. So yes, we're here to educate and raise awareness, to disseminate that information as well through professional networks. So they start to recognise that deaf victims, survivors, they listen to them and listen to us and have those conversations with them. That's what's really, really important, to empower deaf victims to, say something and speak about what's happened to them.
Yeah, thank you. I must say that one of your colleagues delivered a workshop for our team a couple of weeks ago, and it was one of the best workshops that we attended. It was really an eye-opener for all of us, and we learned so much that day. Thank you.
Oh, that's great. That's great to hear.
The next question, what is it like to use the internet for deaf people who are survivors of domestic abuse?
Well, I mean, the internet is so important to the deaf community. It really, really is. Um, we're able to FaceTime, video time friends. We can communicate so openly. And traditionally, lots of deaf people would go to deaf clubs to socialize, have those conversations, chit chat, visit deaf clubs. But unfortunately, deaf clubs are closing. So it's like, where do the deaf community go for those social needs, those conversations? And people do use the internet, which is fantastic. You can easily contact someone, FaceTime, video message, communicate in British Sign Language. And also the internet, is fantastic technology. Deaf people would always rely on hearing people to make phone calls for them. For example, phoning the GP to make an appointment, phoning the bank. So they have to rely on hearing people. This is the same with 999. You'd have to rely on a hearing person to make a phone call for you. So you're relying on somebody else. Whereas with the internet, the deaf community don't need to rely on hearing people to make those phone calls. We can now make those phone calls direct. We've got video interpreting services through banks, so you can phone the bank through an interpreter, so you can have those conversations. And that's my choice, my decision to make that phone call when I want to. And also, many deaf people, their first language is British Sign Language, which means they can express themselves, their thoughts, their feelings in their own language, in their native language, through sign language. Text can be really, really difficult to try and explain your needs or thoughts or feelings, because English is not our first language. So we can't rely on that as much as British Sign Language. It's the same with people who are from different countries. There's different levels of English competencies. So it's about, literacy skills as well. So research into deaf people who leave school, the reading age is around 9. So text messaging or written emails or writing on pieces of paper, you're not really allowing a deaf person to express themselves fully in their native language. So I think the great thing about the internet is you can ask for support. Some people do rely on text message, some people don't. Some people give up because they don't understand what's been asked of them, because the English is not plain English. It can be text heavy and difficult to understand. So people prefer to use British Sign Language interpreters to communicate. So in that respect, it is definitely a positive.
Thanks, Marie. I think that's a really good point about the benefit of the internet and how that can make deaf people independent and more empowered to seek help if they need to themselves without relying on hearing people. And also we did learn a lot through our consultation sessions and the workshop that your colleague delivered, how it is important for deaf people to have video calls, for example, and how that can make a massive difference. So thanks for highlighting that, Marie. How can technology support deaf survivors, victims of domestic abuse? I think we covered that in the previous question, but is there anything at all that you wanted to add around when it comes to deaf survivors and domestic abuse and technology?
So if deaf people are struggling with understanding English and they don't understand how to use the internet, they don't know how to ask for support, it could be that they rely on the perpetrator to help with communication, which means they're allowing the perpetrator to take full advantage of them. And it is, it's coercive control. They could change passwords. They could change access to information. They could change a number of things. And again, it's just a way of using coercive control for somebody who's vulnerable. And they're thinking, oh, yeah, they're helping me. But actually, they're not. They're controlling them. And them not having that awareness of that. But perhaps they have no choice and they just have to put up with it and they just have to go along with it. So that can cause real issues with the internet, and that's the negative side of the internet, I would say.
Yeah, I agree, Maurice, totally. And that's where that intersectionality side comes into it. Because when you are a victim survivor, we all know how the dynamic of domestic abuse is not is it could be complex. And if you are deaf on top of that, that can make it even harder for someone who is deaf. So yeah, I do agree with that. Thank you. What are some of the challenges deaf survivors, victims face when trying to get support online around perhaps accessibility or inclusivity or anything else?
I mean, the internet is great for some deaf people. Some people, may have the skills and knowledge and understanding how to navigate, using text messaging or video calls. But there are deaf people whose, again, like I mentioned earlier, whose literacy skills may not be competent enough. They don't know how to access the internet. It may not be accessible. It may mean that they need text translated into British Sign Language. Some text is jargon heavy and the terminology may not be understandable. So it may be that they need that translated. Maybe they don't even know how to use the internet. So it's thinking about how can you make your text into BSL versions, making it accessible so people understand it. They know how to ask for support. They know how to navigate it. For example, using live chat. It's great. It's fantastic. You can type things in. But if you're trying to explain it in English, which maybe it's not their first language, people like to express themselves in their first language. And for BSL users, that's British Sign Language. And sometimes they find that difficult doing that in English, which could be a barrier with live chat. You can't fully express yourself. So, if there is an advisor, they may be like, oh, what are they trying to say? I don't understand what this deaf person's talking about. So there could be a barrier to communication in that sense of like misunderstanding. Maybe they don't realize that it's a deaf person on the live chat with them, and that there are language barriers. And perhaps a deaf person doesn't realize that they have to disclose that they're deaf to the advisor. So live chat can be a good thing. It can be a negative thing. I think also then deaf people would think, oh, what is the point of me carry on? I'll just give up. Actually, I'll give up on this conversation because of the barriers. And also some websites don't have access to video relay services with interpreters. So, if the option's there, it may mean they click on it and they have access to an interpreter and they can ask for support, in the language that they need. It may be that there's only text message or email options. And again, I mentioned about English literacy skills. It may be that deaf people and the deaf community find that difficult. And it's also just thinking about broadband as well. For example, some areas, they have great speed, great broadband services, but in some areas, the quality of video phone services is not as great. It's not a great quality in some areas. So we need to think about that, because that can actually be really frustrating and really, really stressful. It could be that, they've moved to an area where they don't have strong Wi-Fi quality. And again, the perpetrator could say, oh, yes, I know how to support this. And again, use that control to say, oh, yes, I know how to help with this. But again, it can just increase depression, anxiety. The deaf person can't communicate without using the internet and the broadband. So I think it's really worth thinking about that. So one example is if a deaf victim wants to apply for housing, they have to do a homeless application, but all of those services are online. The forms are all in English, which means for a deaf person, there's just so many barriers for that. It could be that they don't have great Wi-Fi, they don't have any support, they can't complete the application because they don't understand the questions. So again, if somebody understands that and is competent in that, that's fine. But if a deaf person really struggles with English and with texting, or they don't have the right Wi-Fi connection, that can be a real barrier. So we're here to support deaf people, to make sure that they can access the services that they need. And we're unique in supporting them with that and signposting them with that as well.
Definitely, Marie. And we, through our working group, the accessibility working group, we have one of your colleagues who's been attending, and she's been really helping us around how we can improve our website and make it more inclusive for deaf people. So thank you for sharing more around that. We will really look into those kind of ideas and then concerns that you highlighted. What are some of the technology-facilitated abuse concerns for a victim, survivor who is deaf?
So there's lots of concerns, really. For example, perpetrators are using the internet. For example, they'd say to the deaf person, oh, you don't understand English, I'll do it for you. And it's taking that control from the deaf person and not giving them any autonomy. And, saying, oh, I'll do everything for you. I'll do your applications. I'll do the text messaging. And they could potentially pretend to be the deaf person. They could try and do that, because on the internet, how do you know, is that really the deaf person? Because you can hide behind a screen. And I think that's really for deaf and hearing perpetrators. You need to really have knowledge of using the internet to control a deaf person who doesn't necessarily know how to use the internet. Again, I mentioned changing the passwords, finding out where their location is, for example, GPS. There's just lots of different ways that they can control deaf victim survivors. And a deaf person may think, oh, yeah, I'm really getting supported, but actually they're not. And they think, well, actually, I rely on them so much. What am I supposed to do? They have my passwords. They know everything about me. So actually, they just have to put up with it.
Yeah, definitely. And I think through our training sessions that we've been delivering to colleagues from Sign Health, we've been hearing some examples, and those are really good, because it's actually how do we include some of those in like the training sessions that we're developing, or some of our case studies, just to make sure that we are including intersectionality in our work as well, thinking about more people, like more groups of victims and survivors. So yeah, definitely it's been a learning for us as a team. And the other one you mentioned, Marie, also, I think I agree completely about that, using that technology to intensify the control and coerce behaviors. And also thinking about economic abuse as well, how now we have digital banking and all of that, and how that can make someone really isolated and trapped. So definitely. Okay.
Yeah, exactly.
How do you think our tech abuse partnership project can make a difference?
Well, I think we need to make sure that websites are accessible. For first and foremost, make sure that you have BSL versions that have been translated. Give options of ways in which to access that support. Making sure people have knowledge and raise awareness about tech abuse, making sure people realize that deaf people do have barriers when it comes to English, and that organizations need to consider different methods of communication, and just giving the deaf community a better understanding of what is there and what support is there, and for professionals to understand the deaf community as well.
Definitely. Thank you for that, Marie. We've certainly, like I said, through the consultation sessions, through the training sessions, through the working group that we have, we've put together an action plan, and we are working on improving our tech abuse website. And that's thanks to the partnership and the collaboration that we have with Sign Health. How can we, as domestic abuse organizations, make our online support and resources accessible and inclusive for deaf victim survivors?
So I think it's important for all domestic abuse organisations to step back, look at our services, and ask themselves, can a deaf person contact me? And if they wanted to contact me, how would they contact us? I think, when they're referred, if there's no referrals, why are there no referrals? Is it because they don't know you're there? Is it because they don't know how to refer to you? So I think it's about people looking at the gaps, what's missing. Find out more about how you can make your services accessible to deaf people. Making sure that your website says, yes, we will book BSL interpreters if required or needed. Making sure you're giving deaf people the opportunity to perhaps call through an interpreter as well, and making sure you have the funding and resources to pay for the interpreters. That is really, really vital. Make sure you have the money to cover those expenses. Refuge, for example, you have a BSL helpline Monday to Friday, 10 till 6, which is fantastic. But we need more of that. We need more of that support. We need, 24/7 support. Giving deaf people more choices. Thinking about your website. Is it kind of plain English? Is it English that's full of jargon and really difficult to understand? Read it yourself. Do you understand it? Would a deaf person understand it? Do you need to have BSL versions? So videos in which that's, translated. Ask organisations, do you know if a deaf person, comes to your service? Do you know what resources to share with them? Do you know where to signpost them? So I think it's about you questioning yourself as an organisation, do people know how to contact us? Are we accessible? I think that's really important, to think about.
Yeah, I agree 100%, Marie. Thank you. Any last statement before we end the session?
I just think it's really important for all organisations, charities, statutory services. You need to make sure that your services are accessible for the deaf community. I think that's just number one, really. I have to repeat this a lot. You need to be patient when you meet a deaf person, because you don't know the backstory, you don't know what's happened to them. They have been through experience of domestic abuse. They have fear of the deaf community finding out what they've been through. They are unsure whether they've been victims of domestic abuse. So they need time to really process that information, because information isn't accessible. And I think you need to be patient with deaf people when they come to your services. Most deaf people will give up if they don't have the right support. If you say, yes, we'll make sure we book an interpreter, and they turn up to the appointment and there's no interpreter. So I just think it's really important you understand your role. Your services role is to support people who've been through domestic abuse. We're here at Sign Health. We're always happy to support organisations and give any advice. Please just contact us and let us know.
Perfect. Thank you. Thank you, Marie, for joining us today. I hope your messages will help improve the accessibility and inclusivity of domestic abuse services and the resources for deaf people. You have given us a lot to think about today. Thank you. We have a strong and genuine commitment to equity, equality, diversity, and inclusion. Like you mentioned earlier, we do offer BSL service during specific time on the helpline, but we need to look at what else we can do. Part of that is our commitment to work with other specialist organizations in the sector, and we will keep working with and sharing learning with Sign Health. So thank you both for today's session. We've certainly gained invaluable knowledge so far through our tech abuse partnership. So this is the end of the session, and thanks again. We will keep bringing you a series of conversation focusing on more topics. If you've been affected by any of the issues we have covered in today's session, please reach out. Contact us on the National Domestic Abuse Helpline on 0808 2000 247, and make sure you do this from a safe device. You can also chat to us online Monday to Friday between 3 p.m. and 10 p.m. And if you are a BSL user, we have interpreters available Monday to Friday between 10 a.m. to 6 p.m. For information around our tech abuse work, please visit refugetechsafety.org. And if you need specialist support as a BSL user, do contact Sign Health. You could do that by contacting them via email on da@signhealth.org.uk, or you can text 078 00 00 3421. Thanks, everyone.